Namaskar. This video is in black and white because this is how many people, including various healthcare professionals and patients, understand physical therapy. Black and white, where a few modalities is what summarizes for physical therapy. To broaden the understanding, it continuously comes back to the physios to take up the responsibility and keep creating the awareness, because definitely for anyone else to understand your profession, you have to take the lead. Physical therapy is not limited to ultrasounds, lasers, or shortwave diathermy. It is not just about those machines. In India, only recently people have started recognizing the real professional value of physical therapy, but that too is very limited. It is limited to sports scenario, it is limited to injury or trauma related cases, that too very limited in the way people understand it. So, first thing that I would like to bring to your notice is that physical therapy is a much broader and bigger profession than it is presented to most of the patients. All physios are not same and not from the same field of work. There are physios who belong to various specializations. One of them, and only one of them, is musculoskeletal or orthopedic physical therapy, or physical therapy in muscular conditions or musculoskeletal conditions. The idea that goes around is that physios are supposed to treat musculoskeletal cases. That is right. But then there are other fields of work, and they may include fields which are not so popular: physical therapy in obstetrics gynecology, physiotherapy in neurological and psychosomatic disorders, physical therapy in geriatrics, physiotherapy in pediatrics, physiotherapy in neurological conditions of pediatrics, or neurological pediatrics, or neurology pediatrics. I'm using different terms so that people who can't relate to one term may be able to relate to the other. Physiotherapy in community based rehabilitation. Now, that is one thing which I would like to emphasize more upon, because I don't know how much of value is being given to it, but in a country like India, where we still have grassroots level problems of healthcare, preventive geriatric and preventive community based rehabilitation physical therapy can be a big boon if it's put in place in the right way. And how to put it in the right way is have more and more of community based rehabilitation, specialized physios. And community based means use the local resources in remote areas, use the local understanding of traditional and cultural values, and implement it with the modern science of physical therapy to treat cases. And it can help in cases from fractures to strokes to preventive measures in cardiac conditions to preventive measures in chest conditions, even including the infective chest conditions where there may be active and inactive phases, like in tuberculosis, where there may be an inactive and active phase where after a certain point of time lung function may be important and lung function exercises may be important. Similarly, in various fever conditions, viral infection conditions, post viral syndromes, where particularly in remote areas where basic healthcare itself is not reaching out in the best way possible, physical therapy can be a big preventive measure, can be a big post a post disease recovery measure, and it can be very, very, very cost effective. And I said that so many times, that it is very cost effective as compared to letting the patient come to a level where he has to come back to a tertiary or a district level hospital and then face the bigger problems. Even in cases like osteoarthritis, basic knee or hip osteoarthritis, physical therapy in rural, semi rural, small urban scenarios where this is very prevalent. Right assessment at the right time instead of giving them pain relief immediately. Right assessment and right physical activity, just guide them once, twice, or a few reviews, and it may prevent a much bigger complication. What we see is that we are ignoring physical therapy in those aspects, and also what we see is many other ways of exercising are being promoted, and nothing wrong with exercising, but unless an individual is assessed thoroughly, for a person who's not well, who's not uh, having a normally good health, who's having conditions like arthritic conditions or any other health issues, unless the person is assessed, you cannot tell them to watch TV and do the exercises. You cannot tell them to do exercise in numbers of lakhs and crores together sitting in one room or one hall or one big stadium. That has to be done for people who are not suffering ailments. General health is important, general exercise is important, no doubt about it. But please try to understand when it comes to a certain disease or certain specific disorder, unless an assessment, thorough assessment is done by the right professionals, which may include physicians, which may include physios, which may include even other specialists based on the requirement. Like for diabetics, it may be a diabetologist; for cardiac conditions, it may be a cardiac specialist. Along with that, physios can work, coordinate, or physical assessment can be done separately, and based on that physical assessment, exercise has to be prescribed. Not everyone does the same breathing exercise, and not everyone needs the same breathing exercise. How can we promote that? Not everyone needs to stretch the same muscles in a certain way. A person who's guiding you on TV or internet, who may have done his yoga or other techniques for a long, long time, may be definitely more efficient than you. You can't just exactly follow the same. And also, please understand, all the modern science of physical therapy is also involving a lot of those ancient exercise techniques put in the modern perspective. It did not evolve on its own. It's a nice mix where the application of some of the very basic methodologies of exercise which have been followed for ages have been put together, brought into this nice mix or amalgamation of modern understanding of diseases and disorders with modern medicine studies, because of physical therapy studies the modern medicine subjects. And in that, the implementation that goes through is, that is the most important thing, because the implementation that goes through is the implementation which happens with keeping this modern lifestyle in mind. The overall cultural changes, the overall lifestyle changes, the nutritional value of food which has changed, the nutritional value of resources which has changed, has a different requirement in the present context. And we need to implement a science which is more reliable in the present context in the right way. Everything else can be brought into it together. We follow up. Many a times we follow up cases where after a certain point of recovery, patient wants to follow a certain kind of exercise routine. He or she is into a particular kind of martial art, into some kind of other trainings, or sport training or yoga or anything. It can always be done alongside. It can always be used in the best way. There are specialists in every field of work, and they will be able to guide you in that context as well, in that way as well. But don't make it so generalized that you have knee pain, you watch something, you say, okay, knee pain exercises. Now, knee pain exercises cannot be the same for every case. Plus, value the importance of physical therapy as a preventive measure so that you do not have to come to a physio after you are done with many other treatments. After a certain age or after a disease or disorder, be very careful when you decide to do exercise. Let it be assessed, let it be followed up, and physio may be the right professional in that case to help you out. Thank you.